What's the role of MRI in diagnosing a pain problem? Typically, MRI should be used to get somebody ready for surgery. I mean, that's just being honest. I'm just being honest. Like, if you're going to get an MRI, are you willing, if the MRI shows something that can be surgically corrected, ready to get surgery? And if the answer is no, there's no reason typically to get an MRI. Most of the time, the vast majority of the time, by your history, by a good physical exam, the doctor, like myself, can tell you what's wrong. And the problem with MRIs is they have a high false negative and a high false positive rate, meaning about 2/3 of people who have an abnormality on MRI, they actually are functioning fine. Like, in other words, MRIs on people without pain, 2/3 of people have an abnormality on the MRI. The other problem is that people with pain, about half of the MRIs show structures that are injured that aren't injured, or the MRIs are normal and they have pain. So in other words, there's just too many errors or false negatives and false positives on MRIs. So personally, I don't order a lot of them. And often I'll ask people, like, why did you get that MRI? Are you ready to get surgery? For instance, you have pain in your lower back, the MRI shows a herniated disc, and you're getting all this treatment for a herniated disc when by your history and physical exam, your pain's not coming from a herniated disc. So in other words, you're getting all this therapy for a herniated disc and it's not working because the herniated disc isn't causing your pain. It's from your sacroiliac joints. I mean, that's just one example of hundreds and hundreds of examples. And the worst case scenario is then people end up getting surgery for the herniated disc and the pain wasn't from a herniated disc. So ideally, if you have pain and it's not resolving, I would ask you, plead with you, consider going to a doctor who does prolotherapy, get a diagnosis that makes sense, and if it's from a structure that can be helped with prolotherapy, get prolotherapy. Prolotherapy is very safe in my experience. It works very well. It specifically strengthens tissue. And most pain is because there's a tissue that's weakened in the area. If you have shoulder pain right here, there's probably some tissue right there that just needs to be strengthened. That's why you have the pain. Prolotherapy specifically at that area can stimulate healing in that area. The area gets stronger, the pain's eliminated. Typically you don't need MRIs, and often you're well for good.